The scientists in this team have each made important discoveries, but these will only be useful if we can make sense of how they all fit together to understand suicide and self-harm. Young scientists will work closely with these older scientists as a team over 4 years to achieve this. First, we will pull together information on around 8,000 young people aged 10 to 14, a quarter with care experience, to form a cohort, a group of people who all have things in common. We will call this cohort Hearts and Minds because, in future, it can help scientists understand what makes so many young people resilient and why others develop physical health problems like heart disease and mental health problems like depression as they grow into adulthood. Next, we will ask 700 of the young people from the Hearts and Minds cohort to take part in a detailed face-to-face assessment. We will collect information from their blood and saliva about their genetics and immune system, test their stress responses, and ask about their mental health, friendships, family, and neighbourhood. The assessment will also include tests of pain sensitivity. These tests are actually quite fun, like seeing how long you can keep your hand in ice-cold water. We will also see which young people are hyper-responsive, hypo-responsive, and moderately responsive to stress. See if any of these profiles predict self-harm 1 year later, and how everything we have measured interacts to help young people adapt to stress. Next, we will go back to the routine health and education information collected on everyone in Scotland to see which information best describes the young people in each of our profiles. For example, are hyper-responsive young people more likely to be absent from school or have more visits to hospital than hypo-responsive young people? We will use what we learn to develop a risk resilience calculator, a checklist of routine information that best predicts who is most likely to self-harm and when. We will do this through machine learning, supported by the insights of young scientists, where computers pull information together over and over again until they find the patterns that give the best prediction. Lastly, we will test out our risk resilience calculator on a different cohort of 33,000 people, some as old as 44, and half with experience of abuse and neglect, to find out what routine information predicts persistent self-harm into adulthood or actual suicide, and when were the points that we might have intervened.